Globally, over 830 million people live with diabetes, and each one of them is at risk of developing diabetic retinopathy. Diabetic retinopathy is an eye condition caused by diabetes that damages the tiny blood vessels in the retina. High blood sugar can make these vessels weak, leading to blurred vision and blindness over time. By spotting these changes early, doctors can treat the condition before it gets worse.
That's why we built Ocunetra, a smartphone-based eye health platform designed to expand access to early screening for diabetic retinopathy. To be clear, Ocunetra doesn't diagnose, but rather provides the user with a calculated risk assessment, assessing their chances of contracting diabetic retinopathy.
Our value innovation strategy is driven by the ERRC grid. Ocunetra eliminates the needs for expensive fundus cameras that the majority of rural clinics cannot afford. Ocunetra reduces dependence on medical professionals so patients in underserved areas can still get a risk assessment. Then Ocunetra raises accessibility for low-income and rural populations who currently can't reach diagnostic equipment. And finally, Ocunetra creates a new market for home-based non-invasive screening.
After running a feasibility study and creating our own physical product, no new technology is required for Ocunetra. The AI tools, 90D lens, and 3D attachments are existing technology and tools that each individually don't cost too much to run or obtain. Backend servers would theoretically cost $25 per device, covering AI inference for retinal screening and backend server management. The app subscription is additionally free, and the 3D printed attachment is around $1 per unit.
Ocunetra unlocks three tiers of non-customers who are currently unscreened. The first tier, tier one, these are people who are on the edge of our market, such as recently diagnosed diabetics who haven't had their first eye screening yet, along with over 40 adults with rising diabetes risks. Our service accessible market is 830 million people with diabetes, of whom roughly 20 to 30% are accepted to develop diabetic retinopathy and need screening support. Then we have our second tier, the refusing tier. These are diabetics who skip eye exams due to time, cost, or fear. Then finally, our third tier, the unexplored tier. People with undiagnosed diabetes in rural areas who don't even know that eye damage is a possibility. Acunetra is teaming up with health initiatives like public wellness campaigns in order to spread this stuff to those areas.
The buyer utility map shows where Ocunetra creates values across the full customer experience and where traditional solutions fall short. Compared to a standard doctor visit, Ocunetra dominates on customer productivity and convenience. And at the delivery stage, Ocunetra eliminates time due to travel and cost and clinic wait times. During use, our guided app also requires zero medical training. However, doctor visits do hold an edge, and that's in risk reduction, as specialists provides more reliable results. That's a trade-off we acknowledge, however, which is why we train our diabetic retinopathy model at a 99.12% accuracy rate. Then when we compare to Ocunetra to iNUC, which is our closest competitor, the key difference comes down to reach. iNUC is a strong clinically validated platform designed to work within existing hospital systems, but it's never able to reach patients who lack access to these clinical systems, and they're very limited in their numbers. So Ocunetra is able to fill in that gap.
Ocunetra is uniquely positioned compared to its competitors for a new customer base. Doctor visits require the patient to describe symptoms verbally with a hard-to-access visual record. On the other hand, Ocunetra builds a longitudinal scan history inside the app, so patterns in eye health are tracked over visits. iNUC operates through proprietary clinical software that requires institutional licensing and IT setup. On the other hand, Ocunetra is easily accessible on the App Store itself.
Currently, Ocunetra is priced at $99 per kit, and we project selling 15,000 units in year one, bringing in 1.485 million in revenue, where each unit costs about $40 to produce, giving us a gross profit margin of 59.6%. Then after operating expenses, we land a net profit margin of 14.3%. And as of now, the 90D lens, which is the most expensive part of our product, Ocunetra plans on sourcing the 90D lens at a scale through wholesale partnerships, which dramatically reduces the per unit cost, making Ocunetra more profitable.
After each session, the app collects performance metrics and prompts users to complete a feedback form, capturing both quantitative and qualitative data. By using data mining patterns, trends can be identified and used to optimize the app's features, usabilities, and overall experience. Archinator can use its product to detect for diseases such as macular degeneration, macular edema, and glaucoma, all being possible expansions for the app.
This is how Ocunetra's app was developed. By using PyTorch and Python, we set up a training script that pre-processed over 6,000 images from the diabetic retinopathy dataset sourced from Kaggle. For both models, the base architecture that we use in the model training is EfficientNet B3. And lastly, the DR model is trained over the course of 50 epochs.
We conducted pilot testing with the local clinic and consulted with doctors to refine our product. We tested our product on clinic visitors and the nearby community. We also conducted research on our model, working with a professor from Texas Tech to validate our research. Akinator, catch it early, see life clearly.